Hello to all of you. Today we will inform you about nausea during pregnancy. Let's start. Nausea during pregnancy occurs due to hormone changes in the bodies of expectant mothers and is also expressed as morning sickness. Nausea, which is usually seen in the first trimester, which is the first 3 months of pregnancy, continues until the 14th week of pregnancy and then decreases. Women who experience nausea in the first 3 months of pregnancy are considered to have a lower risk of miscarriage than women who do not experience nausea and vomiting. Nausea, which is more common in the morning, can occur at any time of the day. What is nausea during pregnancy? Nausea during pregnancy is a common complaint that occurs as a result of elevated HCG hormone in the body and is considered one of the first symptoms of pregnancy. Nausea, which usually occurs in the first 6 weeks of pregnancy, also brings vomiting. Nausea during pregnancy, which is also expressed as morning sickness, starts in the first trimester and begins to reduce its effect from the 14th week. While some expectant mothers may experience severe nausea and vomiting symptoms, some pregnant women do not experience nausea in this process. This is attributed to the effect of hormones on the body and the pregnancy process. Why does nausea occur during pregnancy? Nausea during pregnancy, morning sickness, is caused by an increase in the level of a hormone produced by the placenta called human chorionic gonadotropin, HCG. The reason why nausea during pregnancy is referred to as morning sickness is that people are hungry in the morning. Expectant mothers begin to produce HCG in the body shortly after the fertilized egg attaches to the uterine wall. Women with severe morning sickness, hyperemesis gravidarum, have higher levels of HCG than other pregnant women. Especially women with twin or multiple pregnancies have higher HCG levels than in normal pregnancies and are more likely to experience morning sickness. Similarly, estrogen, another hormone that increases during pregnancy, triggers nausea during pregnancy, and vomiting is also seen accordingly. Nausea and vomiting complaints that occur due to hormone changes can be relieved by both doctor's guidance and natural methods that can be applied at home. For women who do not experience nausea and vomiting during pregnancy, this can sometimes be worrying, but do not think that the absence of nausea and vomiting is a sign of any problem. Some women who have a healthy pregnancy may not experience any symptoms of nausea. Nausea during pregnancy occurs as a result of the following causes: increased HCG hormone in the blood, estrogen elevation, changes in metabolism, odor sensitivity, stress and anxiety, some stomach problems such as gastritis and reflux, low blood sugar, fatigue. When does nausea start during pregnancy? Nausea during pregnancy, also known as morning sickness, starts as of the 6th week of pregnancy, which is considered as the first trimester, becomes more intense between the 8th and 10th weeks, and decreases its effect in the second trimester period, the 14th week. Nausea during pregnancy occurs due to changing hormones in the body. Nausea, which is known to show its effect especially in the morning, can be seen at any time of the day and negatively affects expectant mothers. Nausea during pregnancy, which is expected to start in the first trimester and end in the second trimester, becomes more severe in women who have twin or multiple pregnancies compared to singleton pregnancies. In some expectant mothers, the condition of nausea that can last permanently until the end of pregnancy is called chronic nausea. In cases where nausea is very difficult and severe, it is necessary to consult a doctor immediately. However, not all expectant mothers may experience nausea symptoms during pregnancy. Women who do not experience nausea, which is accepted as the first symptom of pregnancy, begin to think that there is a problem in their pregnancy. But there is no exact equivalent. Women who do not experience nausea during pregnancy can also have a healthy pregnancy. You should avoid the following factors that trigger nausea during pregnancy: smell of cigarette, heavy perfume odors, odors emitted from detergents and chemicals, intense food odors, staying hungry for a long time. When does pregnancy nausea pass? Expectant mothers who experience pregnancy-related nausea and vomiting complaints mostly seek answers to the question of when nausea passes during pregnancy. Because nausea, which is experienced frequently and felt especially intensely, becomes a condition that affects the quality of life. Working mothers-to-be may be more affected by this issue. It is seen that nausea during pregnancy usually starts in the first months, especially in the 4, the 6, the 8 weeks, and the complaints decrease as the pregnancy progresses. However, there are also expectant mothers who continue to complain of nausea and vomiting throughout their pregnancy. Some complete the pregnancy process without experiencing these problems. Nausea complaints are mostly observed in the morning hours. In some cases, it can be seen that complaints continue during the day. When hunger is added to the sensitivity caused by pregnancy, the problem of nausea and vomiting may become inevitable in some pregnancies. Let's come to the answer to the question of when nausea ends during pregnancy. Nausea complaints during pregnancy usually begin to alleviate as of the 16th week of pregnancy. However, it is also common for complaints to continue in the following weeks, even until birth. How does nausea pass during pregnancy? The way to relieve nausea during pregnancy is to rest. With rest, it is necessary to stay away from odors that trigger nausea. In addition, consuming foods that relax the stomach is also good for nausea. The most important of these foods are toasted bread, salted crackers, fat-free foods, water or iced tea with lemon slices. Avoiding stress is also a solution for nausea during pregnancy. Methods that relieve nausea during pregnancy include the following: resting, drink water, sip by sip, avoiding odors that trigger nausea, consuming toast, salt crackers, and white chickpeas, eating lean foods, increase consumption of eggs, dairy products, beans, and cereals. Throw lemon slices into water or iced tea. If it does not cause nausea, consuming a teaspoon of ginger and honey mixed taking vitamin B6, which reduces nausea, walking and breathing fresh air without straining, avoiding stress and staying in constant contact with your loved ones. Frequently asked questions about nausea during pregnancy. Which gender does severe nausea during pregnancy indicate? There is an opinion that people who experience frequent and severe nausea during pregnancy will give birth to a girl, but this is not guaranteed. Is nausea during pregnancy a good thing? Nausea during pregnancy does not indicate a problem with the pregnancy or the baby. On the contrary, women who experience nausea during pregnancy are considered to have a healthy pregnancy. What to drink for nausea during pregnancy? You can drink sips of water for nausea during pregnancy. You can also consume fruit juices if you have seen that they do not trigger your nausea. Is eating banana good for nausea during pregnancy? Banana is a soft and easy to digest fruit. For this reason, banana consumption is recommended for people who experience nausea during pregnancy. Thanks for watching the video.